Hey everyone that's watching. Apologies for the delay in the start time. There was a little bit of a technical problem with my browser and I was able to fix it. So as you know, today we're going to be talking about equine dentistry, and I could talk forever about dentistry, so I want to make the kind of focus of this talk the myths and misconceptions about equine dentistry, because there's a lot of them out there. Dentistry is a passion of mine and it's something that I take very seriously, so when I see a lot of misinformation out there that could potentially harm your horse, it makes me very concerned. So let's start at the very beginning with why horses actually need dental work done and what we mean by a float when we talk about when your horse has a dental exam and then needs a float. So the first thing to know is that horses have teeth that are very unlike you or I or any small animals, that they have what we call hypsodont teeth, where the teeth are constantly erupting. So they're, instead of just being born with one tooth that gets worn away over the course of their life, they have a very large tooth that the top will get worn away and it constantly erupts upward. So they have a lot of what we call reserve crown, where it's the lower part of the tooth is still erupting into the mouth and is gradually ground away by their normal diet. And because this changing tooth, it means that horses are prone to a lot of changes in their mouth that we are not prone to. Their teeth can shift, their teeth can overgrow, their teeth can grow in the wrong way, and we don't actually clean horses' teeth when we do dentals. We will float their teeth, which the term float comes from an old masonry term where floating was to level a surface. So because the horse's teeth are always growing, they have an offset jaw where their lower jaw is slightly narrower than their upper jaw, meaning that their teeth don't line up perfectly on top of each other. Their lower jaw is a little bit in, and then their upper jaw is a little bit wider. So as they chew, they actually wear these top inside point or top outside points and bottom inside teeth into points. And those points can be so sharp that they actually cause ulceration or lacerations within the mouth. So what we do is we go and take those points and level them out, so that we don't make the chewing surface smooth, we just make those points on the edge smooth. So this makes their mouth a lot more comfortable and a lot more willing to accept a bit and to eat normally. There's a lot of other pathologies that we can deal with in the mouth, but when we say float, we're talking about removing those sharp enamel points on the outside. So what are some things that might indicate that your horse has a problem, that it needs a float? And those are some really common ones that we see are they're dropping feed. And by that, I'm more concerned when they're dropping their hay. Like if you see them take a big mouthful of hay, chew it partially, and then kind of spit it out, that's really abnormal. And we call that quitting. So if you see those big kind of like mashed up balls of half-eaten hay in the background, in the stall, those are what we call quitting balls, and they indicate that the horse is not able to chew that hay appropriately. And they can also drop grain when they're not doing well, but the horses aren't really designed to chew on grain as much as they are hay. So we do have lots of horses that are actually just messy eaters. I have done lots of floats where people will say, oh, they drop grain all the time, but their mouth really isn't designed to chew on that kind of like small little pebbly pieces of grain. So I don't always get super concerned if that's your only complaint, because I've seen lots of horses with normal healthy mouths that will end up dropping their grain slightly, and some of it is just kind of individual genetics, how they're born to eat. So I'm more concerned when they start quitting their hay, because to me that means that they're not chewing appropriately. And we also have some more performance issues in that they can start suddenly being really sensitive on the bit, or not taking the bit, or not going forward, and just kind of resistance, throwing their head around. And that might mean that something in their mouth is uncomfortable or ulcerated or not lining up properly. And we can also see more significant outward changes like swelling on the face because they have those really long roots that are constantly erupting. Any sort of root issue, like if they have a tooth root infection, can go really, really deep into their head and can actually make a swelling on the outside of their face or under their jaw, which is pretty far away from the mouth but is actually related to that tooth root. So any sort of swelling on the face or jaw, or if we ever see any sort of nasal discharge that smells bad, that can indicate a tooth problem. Or if your horse's breath smells bad, if you go give them a kiss on the muzzle and instead of like hay or peppermints or grass, it smells like really nasty, rotten food, that's very abnormal and that should get checked out. So a snotty nose can also indicate tooth problems because, as I said, those teeth roots are really long and the back molars actually get really close to the sinuses. So it's pretty common to have a molar infection actually turn into a sinus infection, which will present as nasal discharge. So those are some of the common things that might present that might make you say, hey, my horse might need a dental exam. So then when we talk about doing a dental exam, there's a few key parts of it that are really important, and this is where we start to get into the kind of misnomers of how things have always been, and oh, this is how my grandparents did their horse's teeth, so that must be how we do our teeth now. But that's not always the case. What we really want is a modern approach to equine dentistry. And one of the reasons I'm so passionate about equine dentistry and client education and making sure that everyone kind of understands modern equine dentistry is that I was that person. I was that person that grew up thinking that vets didn't know how to do horses' teeth, that vets didn't like doing horses' teeth, that they were bad at it, and that you were actually much better off getting someone who we term a lay floater, or some people would call them the tooth fairies. And those were the better people, and they didn't use any of that scary equipment like the speculum and use power tools that were really traumatic, and they didn't have to sedate them. I had a guy growing up who would just come and stick it with a bucket and some tools, and he'd grab onto the horse's nose and shove the file in their mouth and kind of ride him around the stall. And I thought that was better. I thought that I was doing the best for my horse. So I don't ever consider it malice when people are leaning towards these lay tooth floaters or they have a tooth fairy that comes to the barn. But I'm very passionate about education because once I went to vet school and I learned about equine oral anatomy, if I learned about how the teeth work, why they work, what type of pathologies we can get, how we float them, why we use the tools that we do, it just completely changed my view of things. And I had Dr. Chris Pierce, who I went to vet school in Ireland, so we had Dr. Chris Pierce, who's one of the leading equine dental specialists in the UK, came and did a talk about modern equine dentistry, and it just changed my entire view of it. So now it's something that I'm really passionate about because I've been in that shoe before where there's so much misinformation out there. So when we do equine dentistry, you have to have a speculum in. The way that the horse's mouth is shaped, first of all, a lot of people don't really understand how far back the teeth go in the mouth. They go almost all the way back to the eye, which is a very decent length. So you're looking at a kind of a long, dark tube, and then at the very back, the jaw actually curves up slightly, meaning that you have teeth that if you look straight in without having a speculum on, you can't physically see it. So it's not uncommon at all for me to come behind other people having their horse's teeth floated, and they will say, oh yeah, the teeth floater was here and they're great, and I'll go and like the premolars, so like the first cheek teeth look decently floated, but then the back of the mouth is super sharp and they end up getting these really sharp hooks on the back that can cause some problems because it's very, very, very difficult, if not physically impossible, to truly evaluate the back of that mouth without a speculum. And some people will claim that they can feel all of these pathologies that we talk about, such as sharp points and diastemas, which are gaps between the teeth, and caries, which are basically cavities within the teeth. And I call malarkey on a lot of that. You need to visually inspect the mouth in order to do a full dental exam. And without a speculum, that's really not possible. And also, we do sedate for dental exams, and that is because most horses will tolerate a speculum without sedation, but not a lot of them will tolerate the speculum and then you working in their mouth. And when you put a speculum on a horse's head, it's this metal equipment, which is not uncomfortable for them. We don't crank their mouth open to the point where it's painful. We don't even open it as far as they can physically open it themselves. But the sedation keeps them kind of nice and relaxed, so their jaw is not constantly going ar, 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 and trying to bite on that speculum, so it keeps them from getting sore. And also, you can open the mouth, but if you look in it, when their mouth and cheek and tongue are really active, when they're sitting there going the whole time, which most of them will do without sedation, it's, again, impossible to visually inspect everything in the mouth like you should. So could you get a 50% job done? Sure, but in order to really see what's going on in the mouth, you need sedation, you need a speculum, and you need a good bright light source. Now, the sedation that we use for horses is very safe. I have sedated literally thousands of horses in my lifetime. I've done well over 1,000 dentals in my career. And the sedation is very, very safe as long as your horse is healthy enough to handle it. So every time I go to sedate a horse, I listen to its heart because I want to make sure there's no heart murmurs, there's no arrhythmias, your horse isn't in like ventricular tachycardia or atrial fibrillation. I take its temperature to make sure it doesn't have a fever. So if you have a horse that looks healthy but it ends up having an arrhythmia and you sedate it, that sedation causes changes in the blood pressure and can actually lead to significant complications. So that is why even if you do have a lay dentist that will sedate horses for people, just know that legally they should not be sedating your horse, and ethically it's not right to do that without having an exam to make sure that the sedation is safe for that horse. But if we listen to the heart and give it the all clear and say it's a normal heart rhythm, normal heart rate, no cardiac pathologies that we can hear, then it's an incredibly safe drug. As I said, I've done over 1,000 dentals. I've never had a single horse lay down or fall over or anything that people are concerned about. They're actually quite good at balancing themselves. And after we're done, they're kind of sleepy for about an hour and then they're back up to their normal self. I remember my horses growing up actually being pretty traumatized after the dentist came because they didn't use sedation and they basically had to manhandle them and wrestle them and shove these tools in their mouth without any sort of kind of anything to take the edge off. The tools would often come out bloody, which really shouldn't happen in a routine dental, and it's actually much less traumatic to do it with sedation in a very controlled way. And we do use power tools, and I see that Brandy has a question that a comment that people always say to stay away from power tools. And yes, this is something that I encounter quite a bit, in that people will say that, oh, the vet that uses the power tools is going to just completely float your horse's teeth away and they're going to be smooth and they're not going to be able to eat afterwards. And that is completely inaccurate. Actually, you can do a much more precise and gentle job with the power tools. I blame a lot of that misconception based on when the power tools first came out, because for years everyone that's included had to use hand tools, and hand tools have their place and people do like them. I'm not personally strong enough to use hand tools, but it takes physical work to get that tooth reduced. So when you have to really go at a tooth, let's say you have an overgrown tooth and you want to reduce it by a few millimeters, it takes quite a bit of physical strength. So when people were slightly limited to how much they could do in the horse's mouth. And then these power tools came out that suddenly were motorized and it was so much easier. And a lot of these people just went haywire, and not understanding the proper anatomy of a horse's mouth or how they were supposed to do it, they basically were like, I'm going to take away every single sharp point in this mouth because now I can. So I like to use the analogy of you blame the person holding the tool, you don't blame the tool. A well-trained, properly educated person with a power float is going to do way less damage than a halfway trained, well-intentioned person with hand floats. So I also use the analogy with a screwdriver, like a power screwdriver, and just a hand screwdriver. So if you use a drill gun, is it easier to strip that screw when you're putting it in, if you don't really know what you're doing and you're just going rah and going crazy at it, than it is to strip it with your hand tool? Yes, it's easier to strip it with the power drill, but it doesn't mean that it's the power drill's fault. It just means that whoever was using it wasn't being careful enough or was being too aggressive with it. So, and I always show people that haven't had power tools done before that I will take it and I'll put it at full speed and press it right against my hand, and it will not leave a mark. It won't even be red afterwards, because the discs that we use are diamond carbide discs that it's similar to like an oscillating saw or a bone saw, and that it doesn't cut soft tissues, it only cuts hard tissues. So if you're using a power float and it kind of accidentally catches the horse's tongue or the horse's cheek, you're actually not going to cut it. Where a lot of the hand floats that people use, if you run your hand along it, it's actually pretty sharp. So it's actually easier to do damage to the soft tissues with the hand floats than with these new modern carbide drills. And also the hand float surface is not that big, depends on the size, where the power equipment that we use has a head that's about that big or even smaller, which lets us, when we do it visually, be very, very precise of, I only want to take 1 millimeter off of that particular tooth. I'm not doing it blind with a big tool, just trying to get everything down. It's much more precise and actually much more gentle on the horse's mouth. And one of the reasons that hand floats were just kind of so accepted for so long is that we always knew that horses got sharp. I mean, ever since the Middle Ages, they would know about horses getting their teeth sharp and that they would get ulcers and they needed to be floated. But it's only been in the last more modern era that we've realized that there's a whole lot of other pathology that goes on in there besides just sharp points. You can have malocclusions where one tooth is kind of either missing or broken and the other tooth completely overgrows because they need that constant even wear from the opposing tooth to stay even. So if one tooth starts to get either worn or for whatever reason is lower, the tooth opposing it will start to get taller. So there's a lot more malocclusions than we used to know about. We now know that there's a lot more soft tissue involvement in there. They can get periodontal disease, they can get abscesses, they can get dental caries, they can get all of this stuff. And another thing to kind of think about when we're talking about equine dentistry is that horses are prey animals. They're not predator species. They aren't like other species that will show us when they're in pain. It's genetically ingrained into them to act like they're not in pain, because in the wild, if they're being chased by if their herd's being chased by a pack of wolves, and they're going to be seeking out that weakest horse. They're going to be seeking out the horse that's going to be easiest to be taken down. So it's within the horse's best interest to act like they're strong, and especially a horse that's not eating well, that is like big neon lights saying eat me first when it comes to the wild. So that's why horses usually don't show those signs of dental discomfort until it is usually pretty far advanced. That's not to say I haven't floated my share of prima donnas. I'm looking at you, warm bloods, where they will just get the tiniest little point and all of a sudden they're hard on the bit and all of a sudden they don't want to flex to the right. So some horses, the majority of them are going to be kind of pre-designed to hide their pain, but it's not to say that I haven't had some that will be very, very obvious when they need a float. It's very dependent, but I say this so you don't look at a horse and say, oh, they're not dropping their feed, they don't have nasal discharge, I don't ride them, so I don't really care about a bit. So what's the point and why do I need to do their teeth? And it's because they could have a lot of significant pathology in there that we just don't know about. So when we talk about how often we need to have their teeth checked, I kind of a rule of thumb is once a year. If you can think of, I need to have someone looking in my horse's mouth once a year just to make sure everything's good in there. If they need a float, if they need some other pathology treated, great, but that's kind of a good rule of thumb. There are certain populations that I like to do a little bit more often, and that includes very young horses and very old horses. So horses under 6, so not very young, just young, they will have their mouth is changing pretty quickly because they are losing their baby teeth, their deciduous teeth, and then their adult molars are coming in. And actually, deciduous teeth and like fresh molars are actually quite sharp. Some of the sharpest horses I've ever come across have been young horses. So I always say, especially these young horses that they're in training and we want them to be accepting the bit and happy with the bit and nice and soft in the mouth, we don't want to give them any excuses. So people often ask, when should my horse have its first float done? Everyone's a little bit variable, but I always tell them before the first time you put a bit in that horse's mouth. Some people like to break them out a little bit younger. Some people like to break them out a little bit older, but they should at least be floated before they get a bit in their mouth so they don't have any excuses. And also in some of these younger horses, if they have a malocclusion, so if they have the start of a wave mouth where some teeth are low and some teeth are high, if you start that early and get that adjusted early, it's going to be so much easier to maintain that mouth than if you let them grow up until they're 7 or 8 and then that wave mouth's been in there for so long. It's then, not to say you can never correct it, it's just going to take multiple sessions before it's back to normal, versus if you could identify that abnormality when they're younger, you can kind of prevent it from getting so severe. So with the young horse, another thing that I get questions about all the time are wolf teeth. And a lot of people seem to think that their horse's wolf teeth need to come out before training. And if you don't, you're doing the horse a disservice. So just a little bit about what wolf teeth are, because people often get confused, understandably so, because the name wolf tooth doesn't really make sense at all. So a lot of people seem to think that wolf teeth are the canine teeth, and those are the ones that you're going to be seeing between the incisors and the cheek teeth, but those aren't wolf teeth. Wolf teeth are actually vestigial teeth, which means they're still around, but they don't really do anything, that sit right in front of that first premolar, so right before their first cheek tooth. And I describe it as a full-size tooth is a full-size carrot, like a big carrot, and then a wolf tooth is like a baby carrot. So the wolf tooth is much, much smaller. It's usually only about an inch, maybe 2 inches long and half an inch wide. So it has a really shallow root. It doesn't do anything in the mouth. It doesn't cause any sort of discomfort naturally, but where we do run into problems sometimes is that if a horse is having some discomfort in the bit, it used to be thought that all the wolf teeth needed to come out because where they were in the mouth, the bit was going to hit it. Well, they've done x-ray studies, they've done a lot of studies that show that a properly fitted bit should not be contacting the wolf teeth at all, unless it's a very odd wolf tooth that's placed in a very odd location. So a well-placed normal wolf tooth should not touch the bit at all. But what can happen is because that tooth is so short and it has such a short root, they have just a slight amount of more wiggle to them than their other teeth. And even though the bit isn't hitting it, sometimes when that cheek becomes compressed with the bit pressure, just the pressure of the cheek can kind of wiggle it a little bit. And some really sensitive horses can object to that. So I have no problem taking wolf teeth out. It is not something that a lay dentist should be doing because there are some pretty significant complications that can happen if you do it wrong. And it should really be done with local anesthesia and sedation, because otherwise you are just kind of hurting your horse because you're digging it out without any sort of block. You wouldn't want your own dental work done with no block. So it should be done by a vet. people that claim to be lay dentists that just go in and, oh, your wolf tooth's out. I'm betting they probably just took a pair of pliers and broke it off at the gum line, and that the root is still in there. And that root sometimes can still wiggle a little bit with the cheek pressure. So I don't mind taking wolf teeth out. I will take them out if they're requested to. Some particular trainers usually request it. Just because they don't really do anything in the mouth, and every once in a while you come across a horse that's sensitive to it, so we just kind of say, let's not give this horse any excuses to be sensitive. I will say that I have come across plenty of adult horses that have had long, successful riding careers with no complaints that I go in their mouth and they still have wolf teeth. And in those cases, I'm like, if they're not bothering them, I'll just leave them in there. So I don't think every single horse absolutely has to have them out, but I'm not opposed to taking them out if requested. And again, it's technically an extraction, and it should be done properly because there are some pretty major blood vessels in the mouth that can be hit if not done appropriately. So that's with the young horse, kind of misconceptions, and that, oh, my 3-year-old's not doing anything, it doesn't need its teeth done. Well, actually, your 3-year-old probably needs its teeth done more than your 15-year-old in the field. So going on to older horses, that's another population that I like to have their teeth done a little bit more often, every 6 months. The young horses, I like to do them more often because they get sharp so fast and things are changing as their new teeth come in, that I like to at least look in there every 6 months. And then once we get to our geriatric population, we start to see the mouth changing for other reasons. So as we talked about, the big tooth root is kind of always progressing and erupting into the mouth. You get to a point where the horse literally just runs out of tooth. So we see it much more often now than we did back in the 1800s when horses were work animals, because horses are living for longer. And we now know that those teeth, they eventually the horse will outlive the tooth essentially. And when those teeth start to come out is very horse dependent. Usually in the late 20s, maybe in some horses the mid 20s, we start to see age related changes. So what will happen first is the horse, the tooth will, what we call, cup out. So as it's reaching the end of its useful life, the grinding surface has gone away, but there's still a tooth there. So instead of a rough kind of grinding surface, it's like a smooth cup. And that doesn't actually chew any food or grind any food, but there's still a root and there's still a tooth there. So when we talk about a horse that's cupped out, we talk about those teeth are just having normal age-related changes. But what happens is, because that tooth is smooth and not grinding down, that you start to get overgrowth if the tooth below it is still there. So for that reason, I do like to check on my older horses every 6 months just to make sure there's nothing going on, because as we know, with older horses, it's a whole lot easier to keep their weight on them and keep them eating appropriately than it is to play catch up, and once they lose weight, try to put that weight back on. And I've also heard some people say, oh, that my horse is so old, it doesn't have any teeth left, so it doesn't need dentals done. You should still be looking in its mouth, and granted, I do get to a point in a horse's life that they will start to get to the point where reducing too much tooth isn't a good idea. So that's when I start doing what I consider more of like a comfort float. And as this tooth is aging out and as it starts to get cupped, that outside part of that cup can get razor sharp. So even though they might only have like 2-3 teeth left in their head, one of those 2 or 3 teeth can be causing significant issues and making it so they don't want to eat anymore. So I still do like to look in their mouth at least every 6 months to make sure there's nothing significant going on, and if there is, that we can address it. So that is how often I like them to be done. Let's see, we have a comment. I've seen wolf teeth in both colt, gelding, and mare, so it's not gender related. So yes, the wolf teeth are completely non-gender related. Does every horse get wolf teeth? Nope. There are some that don't ever seem to develop them. But also what's likely in these situations is sometimes you get lucky, and as those adult teeth come in, they actually kind of push that wolf tooth out. So I've done dentals in young horses before and seen wolf teeth, and the people are like, that doesn't, like, I don't really care if they come out, they're in a good place, so we leave it, and then 6 months later we come back, and there's no wolf tooth. So it is not uncommon for them to be lost themselves, so they might have been born with them, but they just didn't, they kind of came out before we could take a look at them. So where the gender misconception probably comes from is the canine teeth, because what a lot of people think are wolf teeth are actually canine teeth, and the canine teeth are fighting teeth in horses. They don't actually serve any purpose for chewing or grabbing food. They're just used in the wild as fighting teeth. So that's why stallions will have them, well, now geldings, and usually mares won't. You do get a mare or two that does have canine teeth, but generally it's usually in the males. So that's probably where the gender misconception for wolf teeth comes from. So let's see, I'm just going to see if I talked about all of my things. We talked about what to look for, how often should it be done. We did touch on some of the common dental issues in horses, the most common being the enamel points, but we do know with more advanced technology, now we can see better in the mouth, and we know that there's a whole lot more going in there. We talked about the speculum and the sedation and a lot of other things. I can't think of any other kind of frequent things that I talk about. Those are my kind of most commonly discussed misconceptions about equine dentistry. So I know a lot of people are probably going to watch this later, which usually happens because people can't make it to the live viewings. But if anyone has any further questions or concerns or just wants to talk about dentistry, just give us a call, and I'm happy to answer any questions or kind of go over your own horse and its history and why we think why you think a dental would be needed and what we can do with that. Another thing that I'm going to just briefly touch on before I sign off here, unless there's any, Brandy's question, I'll answer you in just a second. So the one thing I do want to touch base on is we will have some of these dentists out there that aren't purposely causing, these lay dentists that aren't educated. There is a school called neuromuscular dentistry that has a concept that incisors should be the same length as they are at 4 years old or 6 years old, which has absolutely zero evidence behind it, and there's no actual scientific medical data for that. And they will actually take a cutting burr, so it's a wheel that's very sharp and it spins, and go and actually cut down an incisor, and sometimes cut almost an inch off because your horse's incisors are too long. And that is something that can very much, it's probably one of the most common lay dental kind of follow-ups that we do for a horse that had its teeth worked on and then it's not eating properly, because in incisors, the actual live part of the tooth, so the pulp cavity, which is the nerve and the blood vessels, because teeth are alive. We didn't always know that, but now we know that teeth have nerves and blood supplies and live tissue, so we have to be careful with how much we take off. So with the molars, I kind of have a rule of thumb that I don't ever go more than 3 to 5 millimeters at a time. 5 millimeters is being pretty aggressive, but there are things that you can look for on the tooth while you're reducing it to make sure you're not getting too deep, which you have to visually do. So if you're doing it blind or not with a speculum, it's very easy to over-reduce a tooth. But it's much more common in the incisors because there is this school of thought out there that horses need to have short incisors their entire life, and that's just not accurate and is actually harmful. And it's because in the incisors, the vital tissue underneath the grinding surface, or actually the grabbing surface, they don't grind with their incisors, they just grab their feed, is some horses only a few millimeters below the surface. So it is not uncommon to have these cases where someone came and literally chopped off the horse's tooth way too far, and they then expose that really sensitive structure underneath. It can kill the tooth, it can get the tooth infected, it causes a decent amount of pain, and then we as vets have to go kind of follow up with that. So I just am asking everyone to please not let anyone cut your horse's incisors, because that is just not a modern kind of appropriate way to do it. Now, there are certainly times when we can do gentle incisor reductions if your horse is doesn't have kind of like a straight mouth. It might have like what we call a slant mouth, where instead of when you look at it straight on, they don't meet up like this, they meet up like that, or there's a big kind of dip in the middle. And then we can go and with the float kind of reduce it by a few millimeters. But you'll see videos online of people taking incisor cutting wheels and just chopping the front teeth to make them the appropriate length. So just stay away from that. Don't let anyone do that to your horse. It will probably hurt them. And then briefly touching on, since I'm talking about incisors, there is a condition in incisors that more people should know about. It is called equine otodonclastic tooth resorption and hypercementosis, or EOTRH, and that is a disease of the incisors, which for whatever reason we don't know what causes it. There are theories out there, but nothing has been proven. And it seems to be more kind of prominent in geldings than it does in mares, but I have seen it in a stallion and I have seen it in one mare, but it seems to be more of a gelding issue. And basically the roots of the incisors start to just get broken down. The body attacks its own incisors and they start to just kind of get this, we call it lytic lesions, where if you look at an x-ray, it's a big black hole where there should be white bone. And we don't know what causes it. It's only a relatively recent discovery. I didn't know about it when I had horses growing up. I only learned about it in vet school. But it is a condition. It's out there. Unfortunately, the only true way to treat it is to remove all the incisors, because it is a progressive condition and it's a painful condition. And so if you ever lift up your horse's front teeth or lips and you think they kind of have a janky looking smile, or their teeth aren't even, or their gums are all inflamed, you can do a really simple thing. It's called a carrot test, where you take a really big, thick, heavy carrot and hand it to the horse and really hold on to it so they can't pull it out of your hand, and force them to chomp through it with their incisors. Horses that have incisor pain will kind of pull at it or kind of gum at it or kind of shake their head around and not really want to chomp down. And incisor pain can be really subtle, and I've had people that have had horses with pretty advanced disease, and they are completely in denial that there's anything wrong with the horse's mouth. And we finally get to a point where they end up having the incisors removed, usually where they will have those lesions underneath the gum can get to the point where the tooth becomes so brittle that the tooth actually fractures. And it'll get to the point where the horse becomes acutely painful because the tooth fractured, and then they go and take the teeth out, and they're like, oh my god, within like days, they're like, oh my goodness, my horse is a different horse. Like, I just thought he was getting grumpy as he got older, where actually he was in pain. So I've had pretty much every single person that I've had the front teeth taken out that needed it, because we diagnosed this disease on x-rays. They have all said that they didn't even realize how much their horse must have been in discomfort, because it wasn't until they were out that they just seemed more kind of relaxed and calm. I actually had one person who had a horse that was spooky, and all of us were just really uptight and jittery all the time, which was not its normal personality. And we did every single diagnostic out there. We tested him for Lyme, we treated him for Lyme, we tested him for EPM, we looked at his eyes, we did all these lameness evaluations on him. And then one day we were actually doing a lameness workup on him, and he was a relatively new client to me, so I hadn't gotten around to routine dental time yet. And he was kind of curling his lip at something, and his incisors were really diseased. And I was like, that is not normal. So we take x-rays, we confirm the disease, and the owner was really diligent, had the teeth taken out, and she swears that as soon as those teeth were taken out, he was no longer spooky, he was no longer anxious. She texted me and she's like, I have my old horse back. So not to say that every time your horse is spooky it has EOTRH, but it just shows that living in this constant state of chronic pain can cause some behavior changes. So it kind of makes sense when I looked at it in hindsight. So now every time I get a horse with a behavior change complaint, I do look in its mouth and make sure there's nothing in there that's concerning. So let's see, what if they're twisting the head and grain is falling out, like twisting it up in the air? So I know exactly what you mean, the horses that grab their grain and then they kind of like chew on it like this and food comes out. I would definitely have an oral exam done because that can happen for a few reasons. Either A, depending on the age of the horse, if they're an older horse, sometimes they just do that because they're actually losing grinding surface on one side more than the other. So they're just trying to kind of get the food to where the grinding surface is, and we can make their mouth more comfortable if they're sharp. But I tell people with older horses, we don't always change those behaviors because once they start to lose that tooth surface, we can't give it back to them. So if your horse is 30 and quitting its hay, we can do a dental on it, but it's not going to give them those teeth back. So at 15, I would be more suspicious that the horse is either trying to avoid an area in the mouth. So if it has a lot of ulcerations or like a painful diastema or feed packing between its teeth, it's just trying to kind of get the food away from that site. Or if you do an oral exam and everything's normal, sometimes if they have kind of like pain up in their TMJ region or kind of their cervical neck, they sometimes need to chew in strange ways. So while just being a messy eater isn't incredibly abnormal, especially young horses, they just put their food all over the place sometimes. If they get to the point where they're just like chewing a little weird and food's coming out, I would definitely consider that a reason to get some eyes in there and see what's going on and make sure there's not anything painful or uncomfortable that we could take care of. So I think that's everything that I had to talk about. As I said, if you guys have any more questions, feel free to shoot them out. If you're watching this later, I know most people end up watching the recorded version and don't get a chance to watch it live. If you didn't get a chance to watch it live and have a question regarding something that I talked about, pretty much every single topic that I touched on, I could do a whole hour live session just on that. Good thing. Oh, yes. Oh, Willie, we will see you soon. But yeah, we'll definitely look in his mouth on the 20th. But yeah, if anyone has any particular questions about a particular issue they've had with their horse or they've seen their horse doing something weird, then by all means, give us a call. We can talk about it. I love talking about dentistry. I could talk about it all day, every day. So it's a particular passion of mine. I've done advanced training. I've done I've done seminars and continuing education on it because it's something that I enjoy so much. So if you guys have any questions, feel free to shoot them out, and unless I see something pop up in the next few seconds in the chat, I will bid you guys good night, and thank you all for visiting. And again, if you have any questions, just reach out and let us know. Bye!